Good afternoon and welcome to the 4th Diagnostic Leadership Summit. We are now heading into the very perceptive discussion on infectious disease, a growing threat to mankind. We are delighted to welcome Dr. Abhay Chaudhary, Professor and Head of Microbiology, D.Y. Patil University, School of Medicine, Hospital and Research Center. Welcome, sir. Dr. Neha Rathore.
Thank you.
Dr. Neha Rathore, Consultant Microbiologist, Senior Quality Manager, Chairman HICC, QRG Medicare. Welcome, ma'am. Dr. Aarti Gupta, Zonal Head, Lab Operations, SRL Limited, Fortis Memorial Research Institute, will be the session moderator for the panel. Welcome, ma'am.
Thank you.
Sukrit Jobanputra, Director, Advanced Genomics Institute and Laboratory Medicine. Welcome, sir. Dr. Disha Bhatia, National Head, Microbiology and Serology, Core Diagnostics. Welcome, ma'am.
Thank you.
Dr. Manisha Singh, MBBS, MD Microbiology, Vijay Diagnostic Center. Welcome, ma'am.
Thank you.
I now hand over the session to Dr. Aarti Gupta to take this forward.
Thank you, Kachi. Thank you for introducing and thank you for having us over for this very pertinent topic, infectious disease pandemic, a growing threat to mankind. I am delighted to moderate this session with the elite panel of microbiologists. So if you look into the spectrum of human pathogens and infectious diseases, it's continuously changing because of evolution, because of environmental factors, because of, the way things are happening, urbanization. There's a lot of international travel happening. Initially, things were at the local level, then they become continental, intercontinental, and now it is globalization. So, what is happening is because of all this interplay of the environmental and human factors, the infectious diseases are now happening and they are now, spreading, evolving, spreading very, very fast as compared to what was happening earlier. So, most of the infectious diseases, they emerge because of the close contact of human population with the animal or the avian agents. So that's called zoonosis. Now, not just zoonotic diseases, there's another factor, AMR, which is happening, antimicrobial resistance. And when we typically talk of HIV, malaria, tuberculosis, and not just this, there's a lot of emergence happening in the community when we talk of gram-negative and gram-positive bacteria. You have the CREs, you have the VRE, you have MRSA, and so on and so forth. So, a lot of deliberation is required as to how to diagnose them early, prevent them, and treatment of these new emerging pathogens. So not going into much ado about it, I will just open the session with the first question. This question is for Dr. Abhay, sir. Sir, will you please throw some light on the major factors which are driving the rise in infectious diseases across the globe? Abhay, sir.
Yeah. Thank you, and welcome all for this important topic on understanding what is happening with these infectious diseases. Why is there a sudden increase in this? And particularly so because of the COVID, we have really understood that there is something which is beyond everybody's control, and why it is so. Is it really beyond our control? I don't think so. There are certain uncertainties, but definitely we can add on and we can be prepared. So preparedness is the key as far as these things are concerned. Now, we have been understanding about the emerging and re-emerging infectious diseases for over 3 to 4 decades now. And it is found that almost 70 to 75% of these infectious diseases are of zoonotic origin and have a viral etiology. So there is a strong relationship with these etiological factors, particularly the urbanization, deforestation, climate change, unhealthy lifestyles, substance abuse, and so many other things which are coming up, population migration, and alterations in the way we treat. And most important, the travel. International travel has added a new dimension to the rapidity with which all these things. So there are various drivers for the infectious disease to rise, and you'll find that these are not definitely beyond our control, though it is difficult because there are behavioral aspects of this. We have seen that right from the HIV pandemic, which appeared in the last century, and then various infections, particularly viral infectious diseases, where flu viruses were the ones which took a major lead in causing outbreaks and epidemics as well as pandemics. The one which is important and this particular century was 2009 swine flu pandemic. And then subsequently, we have also seen that there are some coronaviruses which have come to visit us and had a major morbidity and mortality. Particularly so with SARS virus, which was in 2003, and the MERS virus, which was from the Middle East. It was also in 2012, and this 2019 coronavirus 2, which was cleared. So all these coronaviruses are important. Now, this climate change has made it possible that there are variations which we see as far as some hosts are concerned, particularly the bats and rats. So these bats and rats are the ones which make a major dent in these areas and are responsible for transmission of variety of these infectious diseases. And that's how we find that these drivers are important. And it is not only important to know what these drivers are, but to really understand over a period of time, like how they are changing. Now, these changes which are seen will derive us or will drive us at getting a clear picture of the drivers which are driving or rather causing these pandemics and further. So there are people we already started asking, it is now what next? Is it COVID over or is it going to continue? Is it going to be more problematic or it is less problematic? Is the vaccine only solution to this? Several answers are there, and definitely we need to check it out. We need to keep it seeing often, and then we say that okay, this is now we have to understand these drivers, these situations which are there, and there are a lot of political situations also that make worse because of these, particularly so with the diseases which are airborne. Now, this airborne transmission or those which are transmitted by air, maybe by for a close distance or a longer distance, variability is there, and all these things make it more difficult. So we have to understand the drivers for the pandemic, see the clear picture, and see how it is changing over a period of time. So that makes us little wiser in terms of understanding how this is going to unfold. The pandemic or the infectious disease are going to be unfold. And there is already a list of infectious diseases which are likely to come up. It was made in last century, when 5 years down the line, 2010, how many would be there? So this list is changing, and geographically it is variable. But overall, there are certain pathogens which have been listed in this, which would make it that no, this is going to be a risk to the whole world. This has got a pandemic potential. And so we have to understand these and take it forward to some more logical conclusions subsequently, so that we can mitigate as per the understanding of these driving forces, how we can try to control it or how we can possibly prevent it. Thank you.
Thank you so much, sir. I would now invite Dr. Manisha's viewpoints on this.
Thank you, ma'am, and good afternoon to everybody. Sir has very rightly said that we have infectious diseases, we have emerging, and we have what we have is the existing one are again coming out, coming, and we are seeing the re-emerging and re-emerging diseases we are seeing. So what I would like basically is to classify them in the various factors which we are seeing. So first and foremost would be the human factors. And in this, what we are saying is because of urbanization and house sanitization and global travel. Global travel is playing a very big role in spread of the infectious diseases. As we are seeing that if you take a COVID only as an example, SARS-CoV-2 only, it started in some small place and it has become a pandemic, and that was that happened very fast because of the global traveling. So here the vector what we can see is the aircrafts and all those things which are increasing the spread of these infectious diseases. Then the most important thing again here, as we see, is COVID has been a very good subject for us for learning. So as we see that these viruses which are there, what it was there in 2019, it has changed and now come to Omicron and Deltacron, and every 15 days we are seeing that some new variant has been seen. And this is either because of mutation, reassortment or recombinations in the viruses, not specifically I am saying of COVID-2, but viruses usually are changing because of mutations, reassortment or recombinations. Then what we have is unplanned migrations in war or disasters. So these again, we are going to the places which are not commonly. Deforestation is leading into the diseases which was seen in the animals and now we can see in human beings also. Then what we have is the food habits. So for example, food habits, bird flu was an example for us. Then, as Madam Head Dr. Aarti has said on the multi-drug resistance. So what we have is misuse of the antibiotics or overuse of the antibiotics. And then with prions. Prions are also now playing a typical role in increase if the instruments are not very clearly sterilized. So because of those also we are seeing some more infectious diseases. Then we have the hospital practices, how the hospitals are practicing it out. They also should have a proper antibiotic policies to resolve this antimicrobial drug resistance. So they should have their policies so to control the drug resistance in the antibiotic on the microbes. Lastly but not the least, sexually transmitted infections are also now coming up. As Sir has specifically mentioned that HIV was a emerging disease or it was an infectious disease. So those sexual practices also, if curtailed properly, will lead into decrease, or we can say this will lead into infectious diseases. It won't be anymore an infectious disease which is upcoming. So these are some of my points here. Thank you.
Thank you so much, Dr. Manisha. Just to add, human behavior plays a crucial role. You have those lab accidents, so-called, man-made agents which have been released. The bioterrorism we all know of. So that also can be a driving factor in the rise of infectious diseases. So my second question is now to Dr. Neha. Dr. Neha, I would like to know what can be done to mitigate the effect of these infectious diseases.
So, ma'am, preparing for any pandemic is a huge challenge because it throws up challenges in all the spheres. Like there are social impact, there is a huge economical impact also. So the best strategy is pandemic preparedness, and the most important one is to strengthen our core infrastructure, healthcare infrastructure, and public health, because it has been seen that in populations which are malnourished or there are a lot of comorbidities in those populations, they cause more devastation. So that is the most important thing which we can prepare. Whatever be the kind of pandemic, we'll be more in a better position when our core health structure is good. So, and the second thing is that when a pandemic starts, you have to work with a lot of agility. So you have to extinguish the sparks and prevent it from further spreading, and that requires a lot of messaging, public messaging, and coordinated efforts from all the agencies. So you mitigate a disaster if you communicate it faster, if you contain it faster. So that is one important thing which we can do. Similarly, we can reduce the infectiousness. Like we have seen in the, COVID has been a very good teacher. So how can you decrease the infectiousness? You cannot work with the virus, but you can provide rapid vaccination and routine vaccinations like children vaccination. If they are done, if there's a huge coverage, then it mitigates the impact of a newer disease which causes significant health morbidity. Then very important thing, if we just look back, we have seen that how we have increased our capacity, the capacity building for diagnosis, for treatment. So this is one thing which at the infrastructure level is required, so we can rapidly increase the testing, the labs, and the reporting structures, so as to contain the epidemic or the pandemic which is happening. Another important thing, as the earlier panelists have already discussed, that zoonosis is one thing we have to keep our eye upon. So this is like having a situational awareness of things, like what is the next thing which is going to come, and not to ignore zoonotics, especially in livestock, where human beings are in constant touch. Like this, for many pandemics, the source has been the markets where all these zoonotic all these different animals were being sold and consumed. So we have to keep an eye what is happening there, and that will help us to prepare more for any subsequent pandemic. So all these things are very important, and if we have a good crisis management team and help of social media, we can disseminate the information. We can teach practices to the general public, like the wash practices, hygiene practices. So all these things will help to mitigate any pandemic effectively. So that's all I wanted to say.
Thank you so much for the insights. I agree. Being prepared, that is the best way to mitigate the effect of these diseases. Dr. Manisha, we want to have your inputs too on this again.
I feel that the first most important thing is prevention is better than cure. And in that way, we are talking about infectious diseases. So, whatever vaccines are available for us, best is we should have the immunization thoroughly for all the vaccines which are for all the infectious diseases for which vaccines are available. And as it is again viruses we are mostly focusing on and now these are the emerging infections. So in that, as we have seen in SARS-CoV-2 also, high resolution contact tracing will be very good, isolation will be very good. Then the I think so from small kids onwards to adults, we have to teach them about cough etiquette, hand washings, and all this. These are very very simple things, but we have somewhere in between forgotten them, and we have to. In last 2 years, we have been doing, of course, but the same thing we have to go on continuing it. What I feel is information, communication, and education is very three important things we have to have. So information about what it is there, communicating and educating the general public. So awareness is there. So there is no, we do not have any fear about it, and we don't. We should use the social media to spread the correct information about the infectious disease, rather than people just taking from negative feedback, which we have seen in last 2 years. Last 2 years have been a very good teacher for us. So I think so with information, communication, and education, we may overcome any future pandemic if it comes. Thank you, ma'am.
I agree thoroughly with you. So we did see a lot of stigma around and not just stigma, fear about people being tested because they had this fear of being isolated, taken away, and being put in some isolation center. So I agree that we need to leverage the power of social media to spread the correct information to create awareness rather than let people live in fear. So we saw a lot of vaccine hesitancy also, but I believe because of this a lot of awareness which was going on in the social media, people did eventually get vaccinated, and that's how we have been able to manage this current pandemic. Uh, my next question will be to Dr. Disha about the technology drivers which can prove to be effective solution providers to combat the rising menace of infectious diseases. Dr. Disha, please.
Um, so I think first of all of us have, due to COVID, launched, technology-intensive solutions in the lab for testing. We're all moving towards increased automation wherever we can, so that we have faster turnaround times, and we can scale the testing as and when required in the wave situation. And basically, right from the testing platform to reporting, we've all rapidly been moving towards automation. So in fact, we recently partnered with a company that's making these algorithmic solutions for single stage combinatorial pooling solutions for PCRs. So that way you can have high throughput testing, your capacity is increased while maintaining quality, and it decreases cost and ensures faster turnaround time. So these are very important in situations like we faced last year, when labs were overwhelmed and people could actually not even get tests when they wanted to. There was a long waiting time. So these things are definitely needed. But the problem is at a larger level. While we are strengthening our existing labs, and in major cities we are going towards full lab automation, the problem is at a deeper level, where the recent WHO report found that only 1% of clinics and 14% of hospitals actually have the equipment or the staff that is required for testing of endemic diseases like HIV, TB, and malaria. And according to a Lancet report, half of the world's population is actually not able to access testing as and when they require. So this is a much deeper problem which cannot be solved by just improving our current major labs and hospitals. So for this, I think the need of the hour is to adopt AI-powered solutions that take a holistic look at the entire supply chain situation. So there are software which are now available, which assess that, where do you need to set up clinics, what equipment and staff is needed, and how to prioritize your spending. So this can really help get a 360-degree view, which we currently, I think, don't have. We take haphazard measures. So there are a number of tools available like this. I'd like to touch upon two. There's OptiDX, which has functioned very well in Zambia, where it's cut down the distance that HIV test samples have to travel by 11 times. So it's, they only need to travel for 3 miles now. So that's a great achievement that increases testing, and of course, more and more people get tested, they can access treatment accordingly. And this software is being rolled out to India now. There's also another one which is Vantage, which is by Broadreach and Microsoft. So this has been used in South Africa. This software was used in to identify COVID preparedness of two provinces, and it managed to flag a shortfall in their PPE and staff for 300 clinics in just 3 days. And accordingly, it gave recommendations of where healthcare workers can be sent on a priority basis to cater to the population best. And it was also used to track individual patients for more than 1,000 clinics in African countries, to see their adherence to the treatment that they were getting. So it's given very good insights, wherein it could predict, using their machine learning algorithms, it could predict which patients are likely to drop out of treatment, and sort of signal the healthcare workers to proactively contact them to ensure that they don't fall off treatment. And they also gave results that in 91% of patients who got a call or a visit from a healthcare worker, adhered to their treatment and took it properly, as opposed to 55% of patients who never had any contact with any healthcare worker. So these insights, I think, can really help us in tackling the problem on a more holistic level.
Thank you so much. I guess AI is the buzzword these days, and we all need to leverage this power of AI. Dr. Neha, your thoughts on this, please.
Other than we have to know the predict. The most important thing is how can we predict faster, which epidemic is going to come. So technologies which help us, like many mathematical models have come up, which have predicted that maybe the next wave will come in this month. So all these technologies will help us a lot in planning how to contain the pandemic and when to enforce certain measures. So these are important. And in medical field now we have lot of technologies which help in new pathogen discovery and diagnosis. So like there is lab on chip, and then wide gene sequencing, etc. So once these technologies are widely used, we'll be able to predict the pandemics earlier and handle them. And we've all seen this, like this Arogya Setu app. We had this Arogya Setu app. It is a very good example of usage of technology, because that when you came, it gives you a red flag if you came in contact with someone. Okay, and you can monitor also. So all these graphs were later on, they were summated at a national level or district level to predict the hotspots. So all these technologies are, they are providing very good solutions. There might be newer methods also, like we also videos of robots who are serving food to patients who are isolated. So that is another aspect where technology can help us to contain the pandemic. Then there are a lot of variables which are coming. So after this COVID came into being, a lot of people started wearing smart watches, having their temperatures and SpO2 measurements. So they give us an early insight. And at the macro level, all these data is integrated somewhere and is being observed by higher agencies, where they can see that if a particular array of symptoms is being reported from one particular area. So these are the solutions which help us, which would help us greatly in predicting and preventing and containing the future pandemics.
Can't agree more, Dr. Neha. Thank you so much. So my next question is now for Sukrut. Is genomic surveillance the best opportunity to prevent epidemics, pandemics actually?
Thank you, Dr. Arti, for posing this question. As we know, genomics is an enormously powerful tool. And in terms of applications in infectious diseases and pandemics, it is very helpful in understanding the nature of pandemic. We With genomic technologies, we are able to identify the mutations in pathogens, and we are able to estimate the nature of spread in the population. So it becomes a kind of a backbone in epidemiology. Uh, it We are able to study the pathogens at a molecular level, which becomes the basis for research, for exploring how this phenomena is panning out, what drug development, for vaccine development. So there are a lot of applications of genomic technologies. Having said that, genomic technologies are also more difficult and complex to implement, because interpreting the data and making sense of it is a more complex procedure. So it needs to be used in conjunction with other technologies like RT-PCR or rapid antigen testing. So from a surveillance perspective, these techniques are definitely a critical element. The main thing is, how do you use it? Now, in the recent pandemic, I think the government of India and ICMR did a fantastic job of connecting with all the labs across the country, and they had developed a system of collecting positive samples and sending them to designated genetic centers where these the samples could be sequenced and the pathogen could be identified. So this is how they had spread this across, and I think it worked very well, except that these during whenever we had a wave, the genomic labs were overburdened. So they were not able to accept all the samples, or there was a lot of lag between the sample processing and the relegation of the information. But then it's okay, because even this pandemic took us off guard in very various ways, and we were able to ramp up the even RT-PCR capabilities in a very short time. So if you see over last 1 year, the number of centers, the number of labs, the number of machines which have got deployed, this has been a really fantastic time to build up the capabilities for testing. And I believe it's a continuous process. So in the next phase or next few months, we will see that there's going to be an improvement in the genomic capabilities as well. So I think the capability infrastructure is slowly building up, and it is going to only aid in our capability to track and handle any particular infectious disorder, because knowing the type of mutation is very useful. It gives us a very nice handle as far as the pathogen is concerned, and then we can figure out what's going to be its spread, how infectious it is, what's going to be the impact on the patient, and so on and so forth. So genomic surveillance is here, and it's there to stay. The main thing is, how do we integrate it with other techniques, because moving like there was a time when there was a lot of emphasis on RT-PCR, so the capacity got clogged. Then suddenly the ICMR and all the other bodies which were directing the testing effort, they started placing emphasis on rapid antigen testing, which was easier. However, it had its own drawbacks. So it's a matter of how do we have a wise mix of these technologies, and we are able to use them properly, so that there is a certain level of on the spot or point of care testing which happens. Then some testing can happen at local lab, and then some testings can be done at a referral lab. So that's how I believe if we use it wisely, we can have a very nice kind of technology backup to tackle any pandemic.
Ma'am, you're not audible.
Sorry. So yeah, I was just thank you, Sukrit. Yeah, I was just saying that I agree. Genomic surveillance is very very helpful when it comes to developing strategies and managing how do we go about isolation, and what extent of strategies are required to prevent the spread of infections. We saw this in Omicron, right? So this brings to the next question: how effective are infectious disease surveillance kits in monitoring the rise in these diseases? This is I would like Dr. Disha to answer this question.
Infectious disease surveillance basically has three goals, which are first is to describe the burden and the epidemiological details of any disease. The second is to monitor the trends, and the third is to identify outbreaks and new pathogens. So all of these require different kinds of tests and different kinds of approaches. Um, so uh, Broadly, these tests are, there are serological tests, which are they're either determining antigen or antibody in blood samples. These will find out the burden of the disease and also identify gaps in immunity in the general population. Then there are bacterial culture tests, which will identify the bacterial pathogen and also determine the antibiogram, because we need to be always on our toes regarding the latest antimicrobial resistance that is emerging, and adapt our empirical treatment and other policies accordingly. And the drug of choice for each pathogen has to be determined based on the current pattern that we are seeing. So, which is also aided by molecular tests. So, even for bacterial pathogens, we're all familiar with molecular tests for viral pathogens, thanks to COVID. But even for bacterial and even fungal pathogens, there are various molecular tests available, which aid the diagnosis, make it faster, and give us quality results. So there are various solutions for that, and there are also these multiplexing solutions, which are based on a clinical condition. So you can just use one sample and directly test it for a variety of pathogens, and also for mutations in the genes which determine the resistance. So this saves valuable time, and we get overall information about the patient very quickly, and these are very, very helpful in such situations of when we're dealing with some unknown pathogen. And then, of course, there is sequencing for completely new strains, or when we have a novel organism, which as we know is not easy and not very widely available, but that is the best tool we have for the novel pathogens that come up. And then there are bedside rapid diagnostic tests, which may not be very sensitive or specific, but their good point is that you get fast information. They're cheap and they're easy to use, so you can use them in many more situations in rural areas, anywhere. It's easier to use. So all these are basically the kits that are used in surveillance activities. But this is about lab confirmed surveillance of infectious diseases. This has to be supplemented with syndromic surveillance. So we can't just focus our activities on what information we're getting from the labs from the confirmed cases. We always have to be on the lookout of what actually is going on clinically in each area. So, as there are already are programs for syndromic surveillance, like fever with rash or influenza-like illness surveillance. Now, there might be patients who are either not able to access healthcare, or they think their symptoms are too mild to go to any healthcare worker. These cases would be missed if we just focus our efforts on lab-based surveillance. So we must look at the data from the syndromic approach as well. And as Dr. Neha pointed out, the best example was the recent, Arogya Setu. This is participatory disease surveillance, where you involve the entire population in contributing to your, um, you know, uh, the major effort of surveillance. Like, we have our main body IDSP that oversees the entire infectious disease surveillance. So there's IDSP, and they have their own separate verticals for the major diseases like TB and HIV. But to add to supplement these efforts, if we get M Health solutions, where 82% of India has access to smartphones. So if people can contribute to that, that can really help. However, we have to be careful of how reliable this data is, because now we are involving the entire population in giving us information on their clinical details. So the data must be reliable, and we have to take into account that there might be digitally isolated populations who will not be able to contribute to this surveillance. Um, but it also has great advantages, wherein the app is also giving advice and good scientific information to the user, without them having to each time go to a healthcare worker and burden the system more. So these approaches have to be taken into account when we're talking about surveillance. And also, we have to remember that we can't look at human health in an isolated fashion. So the One Health approach is very important, as the panelists already mentioned. That now India has got the integrated health information platform, where the idea is to collate information from all the sources, which is your IDSP, then the environmental surveillance, then the zoonotic surveillance, and even occupational injury. So everything available on one platform, so that it becomes easy to analyze all the information in totality. And very important is, after we gather all the information, it has to be analyzed promptly and disseminated in a timely fashion, so that we actually get actionable results. Right now, we might be collecting a lot of data, but the time lag between collection of data and the dissemination of public health information which can guide public health intervention, that that time lag has to be improved.
Thank you. So just to add a little bit to it, in addition to the surveillance kits that are available to fight the pandemic of emerging antimicrobial resistance in hospital healthcare setups, we probably also need to have screening methods in place for early detection of these antimicrobial resistant bugs, so that we contain them and we spread them, prevent them from spreading. So we can have rapid diagnostics for, like, you can have Chromaker, you can have other kits in place, so that you isolate them easily, and then you kind of disseminate the information, isolate them, and prevent the spread. This brings me to the last question. What is the future roadmap of ID prevention in the country? May I have inputs from you, Sukrut, on this?
Well, I think predicting future is always very risky. But since we can't predict future, we can't actually say when the next pandemic or epidemic will hit us. I think there are a couple of things which are required, and these are also based on the learnings from our recent experience over the last 2 years with this COVID pandemic. So, firstly, I think there has to be a continuous strengthening of our technical capabilities. Right? That is something which is very important, because after the pandemic is over, healthcare gets relegated to, it doesn't get the importance that it deserves. So it's like, we can't predict when is the next war, but you have to be continuously be on your toes and be, improving your uh, armed forces infrastructure, so that whenever a war comes, you're prepared. So same is it with healthcare. That has to be a much larger investment in the healthcare at all the levels. The second thing I believe is to have more improved dialogue and information exchange amongst all stakeholders. I think in cases whenever the pandemic hits, there are a lot of decisions which are being taken in isolation by different state and central bodies. I mean, healthcare being a state subject, again, we saw that there was a very vast differences in different types of policies. I don't want to get into that, but we all know how it was in different states. So we need much better information exchange with all the stakeholders. There has to be more free exchange of information. So far, I think this pandemic, the challenge was to manage the public risk perception, and that's where the government had been very cautious about collecting and disseminating information. But for example, India hasn't seen a lot of publications in COVID. So we don't know what's the individual or collective experiences of various labs, hospitals, paramedics. So when we have more free information exchanges, we'll probably discover what went right and what didn't go wrong, didn't go right, or how to handle this better. And finally, I think a much more closer coordination of various stakeholders going forward. So we need to have formal and informal forums where this information exchange can happen, and we can have a coordinated this thing. I mean, I've been raising this at various forums. The whole pricing has been very, very lopsided. There has been sudden rush to do price caps, and everyone has their own version of what is a fair cost of the test. But I think that requires much more discussion, dialogue. There are more than 300 approved kits, right? Each having different strengths and weaknesses. So if we want to be more prepared for any future epidemic, we need to have a more fair exchange of information and have a more collective planning, whether to do more rapid antigen or RT-PCR or genomic surveillance. These decisions right now, of course, they're being taken by the concerned people in charge, but I don't see too much of opportunities to exchange information with them, and that will really improve our response going forward. Right, we've done pretty well when we compared with the global experiences of other countries, but there's always room for improvement, and I think we can do much better when we have more coordination between centers, state, public, private bodies, and then we'll be able to handle these epidemics with much more ease as compared to in the past.
Thank you so much. So, Dr. Abhay, so we would also want to have your thoughts on this topic.
Certainly, as my learned friends have spoken on different aspects of this, some of the most important things have taught us as to while going through this pandemic. Now, this is something which people thought that we are into total darkness and nothing is known, and everybody is trying to understand it or make sound that they know it and then do it. But it's not so. There are certain principles involved in dealing with the health situations, particularly during pandemics or epidemics, and these have been a little restricted previously, although we have seen more frequently in past 2 or 3 decades. So I don't think that this is going to be an end to it. There are people who are very ambitious. There are people who want to do good for the communities, for the humanities. And at the same time, there are people who try to have research, more deeper research with dual objectives. So this is something which is a very controversial thing, and the big bosses in the world order will not agree 100% to what the others may say. Keep apart from those things, but we need to really understand what are the drivers of these pandemic, get a clear picture, and through technologies, keep on getting this information so that we can derive out of that something which would be helpful, which would be desired to understand how this is going to go up further. And this will also keep us knowing what are variations which are happening in the pathogens, in the pandemic infectious diseases, or in the local outbreaks which are happening, maybe in the form of repeated epidemics. Because this takes a lot of toll on morbidity, economic order of the country, and of course the mortality also. So we need to have, and there are a lot of political ramifications of this also. Like we would have done it better. Now that is always possible when somebody else is doing and to pick holes in that situation. But we had to be a total togetherness as far as the response of the population to a pandemic should be, and that is where the strong incentives, which if they are given early, would be definitely rewarding, strong technological advances which are made for individual diagnosis, for quantitative diagnostics, for variations which are happening in the pathogens, and of course the predictability further as to how this is going to shape up the future of the progress of the pandemic or the situation outbreak which is there. So there are a lot of decisions which are beyond health care also. So we need to really understand this and invest more in preparedness for dealing with the infectious disease situations, maybe at a local level in the outbreak form, maybe in the form of a few larger epidemics or even the pandemics. And what is required is the health and not the disease state or not the conditions wherein people are, they are helpless in that situation. We've seen that people taking advantage of this helplessness of the people, and that is something which is not humane. So those are also the situations which we need to see. So we had to be dealing with these very strongly. So there are responses which are required from health sector as well as beyond. The large populations which are dealing with this. Now we have seen that happening at local levels also. People coming together from a small village and then just preventing entry into their village. And it's a small, but having some scientific basis that we don't want anyone, although they are very close, near and dear ones, but since they are living in a different area, now we really want them to be isolated or not come in contact with those of these naive population, which otherwise would have been exposed and may get it. So there were individual responses also by way of their wisdom, they responded to it. And of course, there were situations where the government has come strongly in that fashion. We have also seen that, expensive testing, which was drastically reduced further. Now, how can you explain this to people? So we need to have some introspection on that count also, that something which was available for 6,000 rupees to begin with, and now it is available at 600 rupees. Now, what is that makes you? So we need to have that control over the profitability to the extent, and of course the usefulness of this. I'm touching little, raw chords which are there, but this is the time for introspection now. In dire, grim situations, we really have no hard calls we can take there. That's one thing. So I would say that as a roadmap, we are going to expect some more situations like this. But what is required for that? We need to be prepared, and preparedness is the key. We would have to have some immediate actions, some midterm actions, and some long-term actions. Now, this is the opportunity for us to revamp the whole of the health structure, health infrastructure, and invest more in health rather than in healthcare. Of course, those are different areas, but as a nation, this is something which is going to be more rewarding than healthcare only developed. But of course, we require something which is related to healthcare. People are ready to get into debt to improve their health situation. And that is that we have seen that, something which is unaffordable, but because it's a life and death situation, people do that. What I'm trying to desire or further develop is that we have to be ready, preparedness with the critical supplies, with the drugs which are required, availability of the testing facilities, the availability of the information. Now, during this time, we have a lot of information or explosion through social media, and a lot of misinformation also was going through this. So we need to take care of all these things at a national level, at a state level, develop certain standards for facing such situations, develop, analyze the situation, and accordingly take care of the schools, of the businesses, because we have seen a lot of things suffering because of that lockdown. So we need to have certain guidelines based on that and to be known to everyone who is concerned with that, so that there is no ambiguity, there is no variation as far as supporting the measures against that pandemic situation or outbreak situation. Of course, we have to invest a lot on food and water safety, because these are the ones which also add to this. The pollution and the climate change and etc., these are going to be there. Unless we take care of that positively, we are not really going to get away from that or get benefited because of this. Then we need also to have address on the healthcare needs on a larger scale. How we can just scale it up. And there were very good decisions coming from Government of India and the local governments and people in the authority that has helped in curtailing, in preventing little more outbreak. And of course, there was information related to some of the aspects related to the pandemic in other situations in other countries, and it did not happen in India. So what is that? That made the difference. That has to be understood. It is not that, oh, God is great and it is with us, all the Indian people. No, it has to be properly studied and analyzed, and then maybe have certain amount of research on those topics. And in long term, definitely we have to broaden the health infrastructure about all the possible health. I'm not saying only healthcare, I'm saying health. And that is where we are really going to be benefited by this. The amount of expenditure on health health infrastructure has been increased, and I hope that this is really going to make it. It's not only the healthcare, it's the environmental sanitation, it's the safety of water. It is all these matter in preventing waterborne diseases, in preventing foodborne diseases, which are health related, but because of non-health measures, we can definitely achieve. So we have to be hand in hand working together intersectorally or different areas, and really join hands together with health and beyond for the better society in the coming future. Thank you.
Thank you so much, sir. I really resonate with your statement. Invest in healthcare, but invest more in health. Thank you so much, sir. So, with this, I would just, want to wrap up the session. I just briefly summarize the key points, take-home messages. So we know infectious diseases, they will be continuously emerging and re-emerging. So we cannot stop them from happening because of the environmental factors, because of the human socio-cultural factors, because of the, a great globalization which has happened. So most of them will be because of zoonotic factors, but then not just this, whatever we still have with us, we have this pandemic of AMR happening when we talk of TB, we talk of HIV and all. So to curtail this, we will need to have, better actions directed toward this. Maybe we have to do some regulations in the market, in the way we prescribe drugs, in the way we, let the sale of these drugs happen. The globalization will be there, so these emergence will keep happening. What we need to do is we need to step up our surveillance, we need to step up the research, we need to leverage the power of technology, we need to invest more in technology actually, and automation, artificial intelligence, all of this need to be invested more in. Genomic surveillance is probably something which is the latest on the block. So when we talk of all this, we need to do capacity building in terms of all these, areas that we just spoke of. Preparedness is the key. So for preparedness, what we need to do is we need to, talk more, communicate more, IEC, use of social media. And most important is we need to stand together, if we need to mitigate, if we need to really, manage this menace of infectious disease pandemic, which is actually a growing threat to mankind. Thank you so much. Thanks to all the panelists for their views, and thanks for the team for hosting us. Thank you so much.
Thank you.
Thank you.
Thank you, Dr. Aarti Gupta, for moderating the session so beautifully. And I thank all the panelists for their insightful views on infectious disease pandemic, a growing threat to mankind. Thank you, everyone.
Thank
We
you.
would like to
Thank
inform
you.
the gathering about our upcoming events, which are the 4th Pharma Leadership Summit on the 26th and 27th of April, the 3rd Radiology and Imaging Summit on the 26th and 27th of May, and Medical Education Summit on 23rd and 24th of June. We look forward for your constant support in future as well. I once again extend my warm wishes to all our esteemed panelists for their time and presence. Please accept a small token of gratitude from our end through these certificates that we present to Dr. Aarti Gupta. Thank you so much, ma'am, for beautifully moderating the session. Dr. Abhay Chaudhary for sharing his thoughtful views. Thank you, sir. Dr. Neha Rathod for your thoughts on the panel discussion. Thank you so much, ma'am. Sukra Jobanputra, thank you so much, sir, for your views. Dr. Disha Bhatia for your insightful points on the discussion. Thank you so much, ma'am. And Dr. Manisha Singh, thank you so much, ma'am, for sharing your points. Thank you, everyone. It was great listening to all of you. Thank you so much.
Thanks,
Thank you.
Thanks, everyone. Bye.